everyone. Welcome to Bringing Virtual Care Home. My name is Tina Null, and I will be your host, and I also am the Chief Clinical Officer at Anelto. Today, I have with me Patty Post, who's the CEO and founder of Checkable Health. And we're going to talk today about making care more convenient at home. Welcome, Patty, and thank you for agreeing to be my guest. Can we begin by having you share some of your background with our audience?
Sure. Tina, thank you so much for having me. My background is a little unconventional when it comes to being a founder of a medical device company, but I am a consumer of healthcare. We all know that healthcare can be better, but it was as a medical device executive and clinical research executive that I have my understanding of healthcare, how products are made, how they get through the FDA, how products are sold within the healthcare system, and to clinicians as well. So I took years of that experience, but it was as a mom of three that it's like, I'm not really jazzed about how this healthcare thing works as being a busy mom of three. So I would say that's my experience of being in medical devices as well as a mom.
Okay, well, great. So can you give the audience an overview of Checkable Health and what they're providing in the healthcare space?
You bet. So we are on a mission to move 50 million visits from the four walls of a healthcare setting into the home. And we are doing that through empowerment of the consumer with at-home FDA-cleared rapid diagnostics, telemedicine, education, and through the use of content to educate our consumers. And so our first product that is going through the FDA, our hero product, and why I founded the company was an at-home strep test. And if you think of having a sore throat that gets worse, that could end up being group A strep, and it can be deadly if it goes untreated. But every year, 16 million parents a year go in to check for strep. And 75% of the time, we don't even need to go in. You have a viral infection. So that was why I started the company, is because I was frustrated with having to go into the doctor to check for strep. And in that of the research, we have a longer timeline. I've also in the process of launching 5 new diagnostics and telemedicine in 2023.
Wow, that's wonderful. So when do you anticipate your strep test ready to go live?
Well, we're in clinical research phase right now. So we have 16 active sites across the country currently enrolling. And we plan to be finished with that study in the end of strep season, which is traditionally October through the end of April. And so close that study out, submit to FDA. And our goal is to be on the shelves in cold to flu season of 2023. So parents can buy a strep test at their neighborhood pharmacy or have it delivered to their door.
Oh, wow, that's great. Okay. So can you tell the audience what the return on the investment is for the consumer to receive care at home?
Well, if we look at any traditional non-urgent acute visit, let's call it a strep visit, that usually takes about 4 hours of time for the average consumer, from the time that you recognize the symptoms and that you need to see a doctor, to driving into the clinic, to waiting in the waiting room, and then have the intake completed, waiting again for that sample to be collected, and then waiting for your test results. And then once the test results are interpreted, see the physician for the prescription or not. And then if it is a positive, then driving to the pharmacy. So think of that as 4 hours. And that time of either being away from school or being away from work is quite significant, because if you are diagnosed positive, that means that your child needs to stay home an additional 24 hours until that treatment plan has been administered. So from an hourly, if we work an hourly position, that's a significant amount of time for parents and wages that are lost and time lost in school, which, as you know, Tina, in the last couple of years, we saw our kids not going to school. We want to keep them learning as much as possible. So I equate it to about $500 for every time that someone has to go into the clinic to be checked for strep, and including that cost. I'm on a high deductible healthcare plan, and I'm charged $225 every time that I go in to have my child checked for strep, and that does not include the time spent.
Yeah, so in this case, in the consumer's realm of responsibility, it would just be a matter of purchasing the test, performing the test at home, and then based on the results, then digitally connecting with a provider via your platform to get treatment assigned or started. And then do you have a strategy, a supply chain strategy for getting the prescription to the patient, that kind of thing?
We will, yes. So we'll have the telemedicine offering, and then we will have that prescribing as well. So the e-prescribing to your neighborhood pharmacy. With your pharmacy, many pharmacies now will deliver same day to your home. So we really don't even have to leave the house at all, or just have the parent leave and have the child rest at home.
Wow, that is wonderful.
Yeah, and I think the great thing about this too, sorry Tina to interrupt, but one thing is that post-treatment is once you are prescribed and you get your child home and you administer, your first 3 days of amoxicillin, that's the most common treatment plan for group A strep, is they start feeling better. I mean, they are like within 24 hours, they're bouncing off the walls again. And then day 4, you're back in your routine. And day 5, that's when parents fall off of the treatment plan routine. And unfortunately, a treatment plan is recommended 7 to 10 days, depending on the dosing. But it's when you stop and then you are intermittently giving them that amoxicillin, or what parents do, and I'm guilty of it myself before I knew all of this, is you leave that amoxicillin in the refrigerator and you think, next time that they have a sore throat, I can just give them this and I can avoid the doctor. Well, that's how they end up getting reoccurring strep. And because it will come back in another month, and it's just sort of long-term damage is what I say. But what we're going to do is you can opt in to, hey, Tina, can we remind you to administer your amoxicillin in the correct cycle? So maybe you give it 8 a.m. in the morning and then 8 p.m. in the evening. And just having that gentle reminders like, oh my gosh, okay, I got to continue this until the end of the treatment plan.
Yeah, you are singing my song, because as a 38-year nurse, I can't tell you how many times I have said to family members, do not share that prescription. Take it till it's all the way gone.
Yes.
So yeah, absolutely. The things that we think we can take shortcuts on to make life easier. And to your point about people get right back into their routine rather quickly. And it's not that they don't care. It's not that they don't want to do the best for treating their child, but things get in the way that make them forget. So gentle reminders are a great way to aid that parent in making sure that they're adherent for the best coverage by that antibiotic. So, well, thank you for that. Mm-hmm. So I think you've touched on this a bit, but my next question was, so how do you see this strategy building relationships and trust in healthcare by the consumer?
Well, I think that having that convenience factor, our phone, you probably have your phone right next to you too, Tina. I have mine right here. I'm guilty. My youngest is 12. She has her phone here. She's at the office today. We have a snow day here in North Dakota. But everyone in my building has their phone within an arm's reach. If I can put a trustworthy source of information on their phone, whether that's through podcasts where I interview physicians, clinicians such as yourself, or I have blogs or studies that have been published in one area, adding to that, the treatment plan management, adding to that, just healthy ways of lifestyle of management, whether that's helping you with supplementation, helping you to take to remind you to take your supplements, to offering that telemedicine offering of various physicians or clinicians to those rapid diagnostics that are all FDA cleared. So our strep test is our hero product, but all of our other tests are FDA cleared as well. And I think if you're going to bring your care into the home, you want to ensure that it has gone through the proper testing and is at the right caliber of which a clinician would use in a clinic setting. I don't want to use a generic, well, actually, we shouldn't say that because we both know that a generic versus a brand, they are at parity. And that's the same with what we're doing. I want your diagnostics to be just as good at home as they are in the clinic.
Yeah. So what are some of the other diagnostic tests that your company is either working on or has available?
So we are launching a rapid UTI test and then a vaginal pH test. It falls in our women's health category. And then in the maternal space, we're launching 2 breast milk strips, and one of them will measure alcohol and the other will measure the nutritional value of the breast milk. And then in the middle of the year, we're launching a fecal occult blood test, and that's a screening rapid test for colon rectal cancer. So you can see if you have blood in your stool. And then in the fourth quarter, the strep test. Some of the things that we're working on to fall in that product category or fall really for our target market. Our target market is moms. Like, I am just a champion of mothers, and everything that we do is going to be around a mother. And so when I look at our product roadmap, we're really analyzing right now, what is it that's going to help her? Because Tina, that we probably think of ourselves the last. If you're like me, you think of yourselves, you think of your kids, you think of your husband, you think of your parents. And there's so many others that we think of. And that's what around my company is, that I want to have products that's going to help her and help her take care of her healthcare at home.
Wow, that's wonderful. So before we close, can you share with the audience what the very next things are for Checkable Health and anything else you'd like to share with the audience so that they know who Checkable Health is and who Patty is?
Yeah. Well, right now, just our very easy way of doing business with us is we have a line of supplements that are on checkablehealth.com. And I came up with these supplements because they're very easy to incorporate into your routine, and they cover all the bases, from ashwagandha, which I will take right after this because it gives me that boost in the afternoon instead of coffee, to melatonin. Everyone needs a better night's sleep. It helps us with all ways of life. UTI Prevent, we have an apple cider vinegar gummy to help with digestion. And then we have a collagen that I really love. It helps with your beauty and even with your joints. I have my parents taking them. They both are 82 in it, and it has helped them. So I like it. It's a real well-rounded supplement. And then from there, we'll be launching these new diagnostics and our telemedicine in the second quarter of 2023. So to be in on that, checkablehealth.com is a great way to learn about what we're doing, understand our products. We also have a Checkable Health podcast that's just behind me that you can talk to subject matter experts like yourself, Tina, learn about new therapies out there, as well as we just talk a lot about mom stuff, of things that are happening in our health as we take care of our families and as we age. So the best way to keep in track of us, I would say, is go to our social channels. We do some entertainment too, and that's Checkable Health.
Okay, great. And I know that you're located in Fargo, North Dakota. Is that correct? But obviously your target audience is national. Is that correct?
Yeah. Yep. Yeah. All 50 states. And you can, I'm sure you do this too. I look at where people are tuning in and seeing us on our socials, and we're global. So we'll ship global too on our supplements now, and we will with our diagnostics as well.
Oh, that's wonderful. Well, Patty, it was a pleasure speaking with you, and I wish you and your company great success. I hope our paths will cross
Me
sometime in the
too.
future. Anelto does remote patient monitoring and personal emergency response systems. So there's a lot of touch points that we can maybe collaborate on at some time in the future.
I'd
So
love that.
thank you again for being my guest. And thank you all for joining Bringing Virtual Care Home. I hope you'll join us again in the future for another episode. Have a great day.